Hey everyone, welcome back to the channel. Today, we're diving into systemic sclerosis, also widely known as scleroderma. This is a fascinating yet challenging condition that primarily involves the hardening and tightening of the skin, as often seen in the hands. So, what exactly is systemic sclerosis? It's classified as a rare autoimmune disease. Now remember, in autoimmune conditions, your body's immune system, which usually protects you, mistakenly attacks its own healthy tissues. In systemic sclerosis, this misdirected attack leads to the excessive production and accumulation of collagen, a protein that provides structure for our tissues. This process is driven by complex interactions, starting with endothelial injury, damage to the lining of blood vessels. This damage then triggers an immune response, attracting various immune cells. These immune cells, in turn, activate specialized cells called fibroblasts. Fibroblasts are normally responsible for producing collagen for tissue repair. However, in scleroderma, they become overactive, leading to a massive overproduction of collagen. This excess collagen then deposits in the tissues, causing the characteristic hardening and tightening, not just to the skin, but potentially of internal organs as well. Systemic sclerosis presents in different forms, primarily categorized by the extent of skin involvement. The two main types are limited cutaneous systemic sclerosis and diffuse cutaneous systemic sclerosis. Limited cutaneous systemic sclerosis, the skin thickening is typically confined to areas below the elbows and knees, mainly affecting the fingers, hands, forearms, feet, and face. Internal organ involvement tends to occur later and is often more specific. Conversely, diffuse cutaneous systemic sclerosis involves more widespread skin thickening, extending to the trunk, upper arms, and the thighs, in addition to the extremities and face. In diffuse cutaneous systemic sclerosis, internal organ involvement is usually more extensive and develops earlier in the disease course, often being more severe. Now, let's discuss the key symptoms of systemic sclerosis. For many patients, particularly those with the limited cutaneous form, the symptoms are nearly summarized by the CRIST syndrome mnemonic. This helps us remember five distinct features. C stands for calcinosis. These are calcium deposits that form under the skin, often appearing as small, hard, white lumps, typically over joints or pressure points. R is for Raynaud phenomenon. This is a common and often early symptom where the fingers and sometimes toes turn white, then blue, and then red in response to cold temperatures or stress. It is due to spasms of the small blood vessels. E represents esophageal dysmotility. This means that the esophagus, the tube that carries food to your stomach, doesn't contract properly. This can lead to symptoms like acid reflux, heartburn, and difficulty swallowing. S is for sclerodactyly. This refers specifically to the thick, tight skin on the fingers and hands, making it difficult to bend or straighten the fingers. And finally, T stands for telangiectasia. These are small red spots that appear on the skin, often on the face, hands, or chest. They are caused by widened, dilated blood vessels very close to the skin's surface. Due to the systemic nature of scleroderma affecting connective tissues and blood vessels, various organs can be involved, leading to significant complications, and those include lung fibrosis, kidney crisis, gastrointestinal involvement, and some heart rhythm problems. Diagnosing systemic sclerosis can be challenging due to its varied presentation, but it typically involves a combination of clinical assessments and specific tests. Key to diagnosis is the presence of certain autoantibodies in the blood. For instance, anti-nuclear antibodies or ANA are often positive. More specifically, the presence of SCL70 antibodies, also known as anti-topoisomerase 1 antibodies, is highly suggestive of diffuse systemic sclerosis. A skin biopsy can also be performed where a small tissue sample is taken and examined under a microscope. This can reveal the characteristic thickening of collagen fibers and changes in blood vessels. Furthermore, Due to the potential for internal organ involvement, tests like lung function tests and CT scans of the chest are often done to assess the pulmonary fibrosis or other lung complications. Other imaging and functional tests may be used depending on the specific organ involvement suspected. Currently, there is no cure for systemic sclerosis. However, treatments focus on managing symptoms, slowing disease progression, and preventing complications. Immunosuppressants are frequently used to dampen the overactive immune response and reduce inflammation, thereby helping to slow the progression of fibrosis. Vasodilators are medications that help widen blood vessels. These are crucial for managing conditions like Raynaud's phenomenon and preventing severe damage from impaired blood flow. Physical therapy plays a vital role in maintaining joint flexibility, muscle strength, and improving mobility, especially when the skin tightening affects movement. While living with systemic sclerosis presents unique challenges, ongoing research continues to improve our understanding and treatment approaches, offering hope for better management and quality of life. Thanks for watching. If this video intrigued you, don't forget to like and subscribe, and join me next time as we uncover more mysteries of medicine. See you next time.